Madan already started.
Okay, we are started. Good afternoon, all. Welcome to the third international webinar of the Ayush Valley Foundation. This is the third in the series of our international webinars. We're very happy to have with us three very distinguished people, individuals who are very prominent people in the world of Ayurveda and Indian traditional sciences. We welcome Padma Shri Darshan Shankar ji from Bengaluru. Darshan ji has always been very committed to India's traditional medicine systems and also the local health traditions. He's the Vice Chancellor of the Transdisciplinary University in Yelahanka in Bengaluru. The second person with us, Dr. Asmita Vele. She's the head of Department of Rasasastra in Pune at Bharati Vidyapith. Asmita ji was also India's Ayush professor, the second Ayush professor in Debrecen University in Hungary. This was the Debrecen University's Ayush professorship, was the first Ayush professorships held by the government of India, promoted by the government of India in Europe. And Asmita ji spent about 2.5 years there, and she's back to her host institution. And the third person with us, Vaidya Prasad, comes to us from Kerala. And Vaidya Prasad is today recognized as one of the key Vaidyas involved in management of autistic children. Additionally, he's had the privilege to be a Shishya of Vaidya Thirumalpad, who was one of the key Ayurveda teachers, practitioners in Kerala in the recent past. So I also want to introduce our co-host here with us, Dr. Baswati Bhattacharya. Baswati is a physician trained in the States, in America. And then she went on to do, as a Fulbright fellow, she went on to do a PhD at Banaras Hindu University and does various things, including running a very well recognized and accepted course, online course called from her institute called the Dinacharya Institute. Our agenda for today is to look at the key question about Ayurveda. Is Ayurveda is recognized as a system of medicine for all of us. We all know about it. But we sometimes feel Ayurveda hasn't quite had the freedom it should have based on the fundamental principles that it arises from. It comes from the most fundamental principles that is appreciated and detailed very greatly in the Indian systems of philosophy. And somehow it hasn't come up to a level of maturity that is accepted both within India and abroad. It feels like our traditional system of medicine is still trapped somewhere. And the reasons for this, some are obvious, some not very clear. During our discussions, I listed a few points, what we would try and touch on over our discussions. And shown up here are the principles that we want to kind of cover over the next 120 minutes. We want also to provide a lot of opportunity for participants to engage with our panelists. We are very fortunate to have them with us. So please send your questions in through the chat box that is there on your Zoom screen. Now, I also want to quickly do a review of where we are in terms of Ayurveda education, research, Ayurveda outreach, and certain trends in today's world where health in itself has become a very commercial, commoditized industry. Are these some of the reasons why we feel Ayurveda is not having the freedom it should have? These are all questions for the panelists. As a molecular biologist, I'm particularly fascinated by Ayurveda because the deep principles of Ayurveda, it seems, contains a language and a grammar and the principles that need to take us to the new language that biologists are looking for. This comment was made by Sidney Brenner, the person who gave us the genetic code and several other later understandings, basic understandings of biology. I have qualified Sidney's statement of teaching biologists another language with this additional comment up there in red, which is that this language might not only be just for biologists, perhaps also for doctors, doctors of today and doctors of the future. The history of what we talk about dates back to, some people say, more than 5,000, maybe more than 5,000 years ago. In even the most recent presentations of this knowledge, we have thought leaders, philosophers like Nagarjuna, the second Buddha, who has given us the so-called Panchadasha Prakara of what is health according to Ayurveda. Now, the principles here are very exciting because if you look within each of this, although it is presented in a very poetic way, they're all pointing to the deepest of biological principles in a complex system like the human being. Although we have all this knowledge, all this information, this is the state of play right now in India. I'm told the number of COVID cases are increasing drastically, even in the villages. These were the people displaced from the cities. The number here of 23 million is an underestimate. We could have possibly close to 50 million people who have gone back from cities where they had jobs back to their villages. And unfortunately, some of them taking back with them this infectious agent. Why is all this happening? There could be so many reasons, but what is clear is that it is not for lack of funds for research. These are the 20 top companies as listed in 2015-16, and shown up here is the research budgets for each of these large companies. And that's a lot of money. If you take that figure and you compare it against India's budgets, this is the most recent budget. This is what India has, the budget for the current year, the budget year. This is what India has allocated for health care. And this might well be for both the systems of medicine, or both the ministries that India has for health. And for India, this is a big amount of money, but in comparison to the figures, just the research and development budgets for some of these companies, this figure compares to maybe about the research budget for a company like Johnson & Johnson. There is something wrong here. Is this another reason why Ayurveda doesn't have the freedom it does? Economists might look at this, and policymakers might look at this and say, we need to push this number up so that we can do more. There might well be another group of people who say we should put this down to zero and rethink the whole issue of health. And with that, I finish here, and I leave it open now for us to discuss this. We have the format which we will try and follow is a format of interaction and interactive discussion. So I invite Dr. Darshan Shankarji to start the ball rolling and share his thoughts. Darshanji has extensive experience in all of these areas, and particularly is passionate about India's traditional health systems. He has lived with people down in the most remotest areas, particularly Maharashtra, and he has seen it over the last perhaps 4 decades or more on how these things play out in real life. And maybe Darshanji is the best person to comment on whether there are some errors and why Ayurveda feels trapped without the freedom it should have. Perhaps you can enlighten us, Darshanji.
Okay, can I be, thank you, Madan. Can I be heard?
We can hear you clearly, thank you.
Yes.
Can I be seen?
Yes, we can see you clearly. You have a blue shirt on.
No, I'm speaking from my cell phone because I'm somehow not able to link it properly with my computer. That's why I'm asking whether I can be seen and heard.
We can see you and hear you. Darshan, thank you so much.
Okay, all right. So then,
if it is possible to rest your cell phone, then there might not be too much movement. And I'm assuming you don't have any slides or something you want to share.
no, I don't have.
Okay. Thank you, Darshan.
See, my view is that the biggest challenge really is of leadership. Leadership which can take strategic interventions. I'm into grow Ayush and Ayurveda in particular, which is the aspect of Ayush I am more familiar with, to grow Ayurveda to its full potential. I think the challenges of strategic interventions, which of course need good leadership. Now let me explain what I'm saying.
Darshan, before you start, could we can't see your face. If we can, that's much better. Thank you so much. If it's possible to rest your phone at that angle, then all our participants will be delighted to see your face too.
Well, right now,
we don't want to
okay.
cramp.
As long as I'm being seen right now, I'll continue.
Thank you.
See, my estimate of the size of the Ayurveda sector is that the Ayurveda sector is generating something of the order of 70,000 crores per year, which means a little around 12 billion US dollars, if you want to look at it in terms of US dollars. So the size of the Ayurveda sector is of the order of around 70,000 crore, and it is growing at around 20% per year. At least segments of it are growing at 20% per year. government interventions in India are possible only through the Ministry of Ayush. And as you probably know, the annual budget of the Ministry of Ayush is of the order of around 2,000 crore per year. Now, it's easy to understand that for a sector that is already generating something of the order of 70,000 crore per year, and I'll go into details on this a little later, 2,000 crore cannot possibly grow a 70,000 per year sector. It cannot grow it. It can only make strategic interventions. And if it does not make those strategic interventions, then it is unlikely to have any impact on the Ayurveda sector, because it's a big sector, 70,000 crore. So that is why I started off with a statement saying the challenge is for strategic interventions. Now, this 70,000 crore is being generated by three dimensions of the Ayurveda sector: by industry, which is perhaps today having an annual turnover of around 40,000 crores per year. Then you have the health services, thousands and thousands, maybe over 100,000 health clinics all over the country, several hundred hospitals all over the country. So there is the service sector and a newly emerging spa segment for wellness. So you have this segment of the Ayurveda sector, the health services. And then, of course, you have investments that are going into education. There are around 400 institutions at work with 25 to 30,000 students enrollment every year. And so it is these three segments of industry, of health services, and of education that account for my estimate of 70,000 crore per year being the size of the Ayurveda sector. So I'm saying when this is the size of the sector and it's growing, a 2,000 crore budget from the government of India is a very, very small amount for growing the sector. It doesn't need this 2,000 at all. It is growing on its own, and it's growing at segments of it. Industry is growing at 20% growth rate per year. Services are also growing pretty rapidly. So industry and services do not need any support from the 2,000 crore annual budget of a government of India. So what is this budget of 2,000 crore of the government of India? What is it that it can do? It certainly cannot grow the sector. The sector doesn't need that money. It's already self-generating at a level which is far higher than what government can possibly invest. You can see the figures, 70,000 versus 2,000 crore. So all that 2,000 crore can do, and that's important, is it can make strategic interventions that can trigger growth. These may be policy interventions, they may be regulatory interventions, There may be various kinds of demonstration, pilot projects. So the role that 2,000 crore a year, which is the state support, the government support, unless it is strategically done, it will have absolutely no impact on the growth of the sector. Now, is this sector growing very well, very healthily? In financial terms, it's quite substantial. Maybe if people start doing a critique of what is happening in industry, what is happening in health services, what is happening in education, one might have a critique and say there is a great deal of commodification that is happening in the growth of the sector. The sector is growing, but perhaps it is not growing in the way it should from a societal perspective. Now, it is certainly getting commodified. We may have a critique of what are the kinds of products that are there in the market. We may have a critique of the kind of health services that are being provided, which are becoming more and more mimicking the allopathic health services, which are disease-oriented. The concept of swasthya, etc., you can't really see in the service sector. It is becoming very similar to the allopathic sector. So we may have a critique, but it is growing. It is 70,000 crore annual turnover. Now, if you want to change these directions, then you need strategic interventions. So now let's look at the ground reality of these segments of the Ayurveda sector. I club health services and drug development together. What do we see in the entire Ayurveda health services? Most of the health services are actually being provided by non-government organizations, not by government. I mean, if today one is talking of health services in Ayurveda, then, one will point to Kottakkal. One will not point to some government hospital anywhere in the country. I mean, government hospitals are, in fact, functioning much better in Kerala and in pockets of different states. But overall, so far as the public is concerned, if you're talking of health services, they'll say, go to Kottakkal, go to Coimbatore, go to maybe our own institute, IAIM in Bangalore, or go to this place in Madurai, and so on and so forth. So, but if you look at the health services, which are also growing, I mean, I think the turnover of health services is a substantial part of the 70,000 annual growth, annual turnover. What you are seeing, and I am simplifying and generalizing, what you are seeing in health services is growth is happening. There are more hospitals happening. There are more and more clinics coming up every month, every year. There are more spas coming up. But if you are to sum up the kind of growth that is taking place, then you can sum it up in one line. Health services are indeed growing, but without generating any evidence about the effectiveness of their services. I'm not saying that these services are not effective. All I'm saying is they are growing without generating evidence about their effectiveness.
That's such a great one line to summarize it. And Darshanji, if you'll permit us, in order to make this into a discussion, shall we get some input from the other two discussants and then we'll come back to you?
I mean, you all are running. Yes, sure. In any way you like.
You've given us such a great number of facts, but to keep this from becoming without debate. Well, I don't want to say monologue because I think we all love to listen to you, but I also want to get other inputs and maybe get a little
Please
bit
go
of
ahead.
a tug. So let me ask Ashmita Wele, who spent 3 years in Europe and has traveled around Europe and seen how Ayush and the health sector, as you put it, the drug development and the services industry, as well as the products industry. You mentioned the industry itself, the health services, the spa and wellness, and the products. And I didn't hear you say research in academia or education.
No, I haven't come to that. I've just started with ground reality of health services. Yes. I have a lot to say on education. I have a lot to say on research.
And we will come to that. So just focusing on health services, I'm going to ask Ashmita Wele and then Vaidya Prasad to just add to what you're saying so the discussion can become more robust. Dr. Wele, what do you weigh in on this?
Yes, as Darshanji has pinpointed, he has kept his finger at the right moment, at the right point, that the sector is growing on its own. And definitely, when it is growing, there is lack of evidence generation for the effectiveness. That's what I have just written down. That what we need to do is documentation. And when people and services are growing, simultaneously there should be documentation. But in a busy clinic where a person is checking, say in the morning shift, 30 patients, in the evening shift, 20-25 patients, or overall average in a day 50 patients, how is supposed to keep track of what he is prescribing, what effects are coming up? So here there needs to be a teamwork and there needs to be a system in place which can document all these services and practices. This demand is coming from the practitioners that, okay, we know that we have to generate data. We know that we should keep track of all these things. And there is good work is being done. There are certain companies like Ayurveda or Vaidya. They have come up with a software. Ayusoft software was there to help Vaidyas. In Maharashtra, Dhupapeshwar has come up with certain software. So people are working to fill this gap. But very importantly, we need to identify the gaps and we need to come up with the solutions. We cannot just say that government, we are sitting here, we are doing, our job is to practice, my job is to teach, somebody else's job is to do research, and somebody else is working with the society. And that's all. It's not going to work like that. So everyone, while doing his or her own dedicated job, we have to parallelly think of using and developing and working together, making a team like a task force. That's what I think when Darshanji points out that yes, there are pockets, the sector is growing, and we need to generate evidence.
Ashmita ji, I'm using Ashmita's first name because I've known her for 6 years. Dr. Wele, Ashmita.
No, Ashmita is fine. Not even G. Yeah.
So the point that I got from this part, which perfectly segues and interfaces with Dr. Prasad, is to say, how do we interface the different sectors when we're doing our individual jobs? As we're doing them, how do we be aware of the others when we're so busy from morning to night in our particular area? For Dr. Prasad, who's a consummate clinician, can you just discuss the health sector's part that Darshanji started with and Dr. Wele has continued, please?
Namaskaram to all my fellow panelists and the host. I think I would like to come to that point with one or two introductory notes that we are discussing on about the freedom of Ayurveda on the eve of our Indian Independence Day tomorrow, which is very nice to think about because this is the right time to think about freedom, obviously. And another interesting thing is, this is the centenary year of one big event. I do not know how many of us remember it. Actually, it was in 1920 Nagpur Congress of Indian National Congress that a resolution was made by the then Indian National Congress Committee that Ayurveda should be resolved as the national medical system. So it is quite maybe a coincidence, but that we are talking it on the 2020 about the freedom of Ayurveda, which looks quite interesting, maybe a coincidence. And I was asked to say something about the practice. Actually, my inclination is towards, I'm a practitioner to the core, and I am more about the informal part of Ayurvedic education also. So I would like to connect these two together, because we cannot separate these education part as well as the practice part as separate ones. Because if you make confident practitioners, young graduates from the academies, obviously that will be reflected in the practice field. But unfortunately, that is not happening. By and large, we are producing B or C class MBBS graduates from our Ayurveda colleges, not A class Ayurveda graduates. So that is a big problem that we are facing. Then how can you expect Ayurveda Vaidyas to practice with confidence in the society? How can you say that I'm a Vaidya? So that is the big issue that we are facing as far as the practice field is concerned. Every time when you talk about Ayurveda, you yourself feel that there is something inferior in it. So that should not be the case. You should be confident, you should be proud of your legacy, your bulk of knowledge, the big magazine of information that you carry with you. So that is the way in which we should be projecting our graduates into the society, without which whatever amount you spend on Ayurveda, whatever things you spend on Ayurveda, somebody else may be benefited, but never it will come to Ayurveda. We need confident first-class practitioners who know the Ayurveda to the core. And for that, we need perfect separation of the undergraduate syllabus and the postgraduate syllabus. In the undergraduate syllabus, our aim should be to have excellent Vaidyas, and the syllabus and the curriculum should not be having a dominance for the Western allopathy practice or Western allopathic system. It should be pro-Ayurvedic. We should have a thorough understanding about the thought, the yukti of Ayurveda. You should not be judgmental on Ayurveda with your preoccupied notions of Western medicine. And whenever you are not able to address an Ayurvedic principle with your preoccupied Western notions, you are not supposed to be disappointed. Because our Vaidyas, including the teachers, very sorry to say that I am also a teacher, have no understanding about the way in which the logic evolved from the Darshanas. So, and they are going to teach the next generation. And I was surprised to hear teachers, senior faculty, even yesterday I heard that one teacher was just making a statement that I am not very confident about Ayurvedic diagnosis, so I go for allopathic diagnosis. So when we have that sort of issues down on the platform level, at the ground zero level, how can you expect people to come with confidence and engage themselves in very interesting or full-fledged Ayurvedic practice? I'm from Kerala. And see, I'm sitting in front of you in a time where Ayurveda is kept away from practicing their own system, their medicine in this time of pandemic. Practically, it has come to a standstill as far as COVID management is concerned. No Vaidya is allowed to practice to treat a COVID patient. See the condition. I'm talking from Kerala, which is supposed to be the best soil for Ayurveda ever in India. And you know, we have done more than 170,000 people taking Ayurvedic prophylactic medicines, and only less than 1,000 of them have turned positive in the last 6 months' time or 5 months' time. Still, these Vaidyas are kept away from treating a COVID positive patient. You see the level of frustration that these Vaidyas will be having in their mind. So how will be their morale? So there are many issues related which are bridged together with education and practice. So that is where we have to address these issues. Outside Kerala, to the best of my knowledge, except some pockets in Karnataka and Maharashtra, most of the graduates are practicing allopathy, including well-known national institutes. So how can you expect confident, proud Ayurvedic graduates to be spread across the country? So what is the meaning of increasing the industry? What is the need of Ayurvedic graduates? What will be the fate of Ayurveda Shastra in spite of all these crores?
Dr. Prasad, this is a wonderful way to move us into the next part of Darshan's comments about education. So if you can hold that question or conclude what you wanted to say, I'd love to have Darshan ji come back and introduce some of his thoughts about education. And then we'll come back.
Yeah, these are my major concerns, ma'am. Obviously,
yeah.
I will join together. I mean, join with you maybe in the next level, next stage.
In the next stage. So let's take this idea of the health sector not being able to move forward in the robust way that it would like, because there is actually a thought that the education that we're producing is not at the level that it needs to be. In fact, Dr. Mala Kapadia just put a question onto our chat, and all of you please discuss with us on the chat so that we can have everyone involved. She says, what is the solution and when will it change this problem of mediocre Ayurvedic practitioners who are not confident? So let's go back to Dr. Darshan Shankar, who is also an education expert. Darshan ji, tell us.
You know, I again stress my opening statement saying there is huge potential of Ayurveda because of its inherent strength that was partly alluded to by Vaidya Prasad. There is enormous strength in the Shastra, and it is that from that strength that all that is emerging, some things good, some things very, very mediocre, some things substandard. They're all emerging, but from that core strength. If that strength was not there, there would be nothing coming out of it. And my statement in the beginning was that we need today the challenges for strategic interventions. So now if you are asking me, what are the strategic intervention in education? So that's where the debate has now come up to education. I think that is really the main area of intervention. And what I would say at a very broad sort of a level is that the Ayurvedic community has to challenge the medical councils who are designing and regulating medical education. I have been pleading in forums where I have had the opportunity to participate in discussions on education, and which is currently the Niti Aayog. And I have been saying, look, while there may be a minimum standard of education which the councils have prescribed, and you for ordinary institutions, that minimum standard is necessary because medicine is a public health intervention. We need to create at least minimum standards. But why can't we go beyond minimum standards? Why are we not looking at centers of excellence in education which are autonomous? several years ago, maybe 20 years ago, 25 years ago, Krishna Kumarji in Coimbatore did a small experiment of some kind of a Gurukul method of education, which was 8 years, after standard 10 or something. And in the brief period of a few years that he experimented with this model, which was his model for improving education, we do know that a number of graduates who graduated out of that scheme of learning have subsequently been doing outstanding work. Now, that is one model, but that was a model outside or a bit out of the way from the regular models, which are, 10 plus 2 and then 5.5, in the very highly regulated way in which the minimum standards are being executed. Now, my recommendation is that the Ayurvedic community must be able to convince these councils to open the doors for institutions with good track records to become centers of excellence, to become autonomous in the way they execute the education program. We should stop being bound by the minimum standards. The minimum standards are for ordinary, mediocre institutions. The best institutions who have some track record must come forward and insist on making medical education at higher than the minimum standards. We only need to agree to a framework of objectives and so on and so forth, but the methods of teaching, the curriculum, the method of assessment, all this should be innovated. Innovation is the need of the hour. There is absolutely no scope for innovation in the way in which education is currently being implemented by the medical councils. Nothing is going to come out of it. No matter what Vaidya Prasad may lament about the quality of education, in the system of education that is currently being executed through a prescribed way by the medical councils, and we know lots of non-medical things that happen through these medical councils, we have to create a window for innovation. Innovation will only come if institutions, and you can lay down the criteria for assessing someone who has a good track record. Based on that criteria, certain number of institutions in the country should be freed from the minimum standards and execute models of excellence. There need not be one uniform model. There can be several models. Krishna Kumar tried one model. If I were to do an education, I would do a different kind of a model. Now, allow those institutions, who have track records to get out of those minimum standards. That is the only way in which education reform will happen. It will simply not happen in the current system of highly restricted medical education that the councils have prescribed. They're sticking to minimum standards. Nowhere in the world can education innovation happen in such a restricted manner. Now, I am not getting into details of what